Good evening, everyone. We are going to go ahead and get started. My name is Caitlin Neese, and I want to welcome you all to Tactile Medical's World Lymphedema Day event, Lifting Lymphedema Care Together. We had a total of 240 people register for our first ever patient-facing webinar this evening. So whether you are a patient, a provider, or maybe a family member who is supporting someone living with lymphedema, we are truly honored to have you here with us today. I'm excited to introduce our esteemed panelists, three individuals who are deeply committed to lifting patient care. Starting off, we have Alexandra Hill, who is a PT, DPT, and CLT LANA. She works at Oncopelvic PT, where she treats lymphedema head to toe, but specializes in pelvic lymphedema treatment. Her social media with patient education can be found at Oncopelvic PT. Next, we have Margaret Walborg Silva, who is an OT CLT LANA at Sibley Memorial Hospital, Johns Hopkins Medicine, where she treats all lymphedema, but specializes in head and neck cancer-related lymphedema. Her social media with patient education can be found at Lymphatic Health and Wellness Coaching. Last but not least, we have Sherry Dodd, who is the CEO of Tactile Medical, joining us this evening. We will have Maria Watson, who is a PT and the Senior Clinical Specialist at Tactile, and she will be here to support any tactile-related questions at the end of the program. So one thing before we get started, our hope is that you submit any questions that you have through the Q&A icon during the presentation, and we'll do our best to answer those questions at the end. So with that, I would like to hand things over to our CEO, Sherry Dodd.
Thank you, Caitlin. I am so pleased to be kicking off this event so focused on patients, which there's a absolute sense of calling, and that I know you'll hear it directly as you hear from Alexandra as well as Margaret. I don't have my own social media, but what I do have is an upcoming video that you're going to see next, which is really directed for you, for patients with lymphedema. And from that video, I'm going to go through and talk about some of the research that is supporting why it is so important that we take our passion and our focus on patients and turn that into action so that the patients that are suffering with lymphedema can be on the very best trajectory for better outcomes and support for their condition. So with that, let's go to the video.
It starts with something feeling off. A swelling, a weight, a quiet ache. A patient enters the unknown without a roadmap. A provider searches for answers without the tools. A healthcare system faltering for those it's meant to serve. The silence is real. The delays feel endless. The burden grows. Physically, emotionally. Options narrow, and the hope for a better path feels out of reach. This is lymphedema, a chronic condition that affects millions, yet is too often misunderstood, misdiagnosed, overlooked, or outright ignored. For those who live with it, too much depends on chance. The right provider, the right diagnosis, the right documentation. Too often, none of it comes. We refuse to accept that.
Hi, my name is Lana, and I'm here to tell you my story. I'm 80 years old, and when I was in my 40s, or maybe even earlier than that, being very active, I noticed that, especially after skiing, my feet would swell. Eventually, I was diagnosed with venous insufficiency. My feet or my legs took longer and longer to recover, to the point that at times the swelling would become so intense it felt like the skin was going to break open. However, anytime I mentioned it to a medical doctor, they would say something like, oh, that's interesting. Or maybe it's inflammation and perhaps a change in diet. Nothing I was able to do as far as food. The condition progressively got worse. It wasn't until I had another venous intervention that the PA said that I was suffering not only from venous insufficiency, but also lymphedema.
You know, when I think about what else I should have known about lymphedema, having it explained a little better initially would have helped. And maybe a little more emphasis on how to avoid it. Once I got it, I think I should have been advised to keep a really close eye on it. And had I think I would have started or sought treatment again, or to know that there is treatment available after initial treatment. That could have made a lot of difference.
Hi, my name is Sarah, and I'm here to share my journey with head and neck cancer. I started with a spot under my tongue that my dental hygienist noticed, but then it had spread to under my tongue to the floor of my mouth, and I finally got back virtual with my primary care. He came back and said, you need to get a biopsy tomorrow morning. The biopsy came back with squamous cell carcinoma. I was stage 4. It had spread to my lymph nodes and my chest. I had bilateral lymph node removal all the way down. And I did end up getting lymphedema, which I did not understand before. I never even heard of it. You don't study the lymphatic system in school. So I was in speech therapy at the time, and I asked her if she knew of a lymphedema therapist, and she referred me to Margaret Wahlberg Silva, who truly, working with her, has changed my life. I now have a life again, and it makes me cry. I can't even tell you what Margaret's done for me. I can't.
Whether you're a lower extremity patient still searching for a reason for your pain, a breast cancer survivor who was never told that lymphedema could be part of your story, or a head and neck cancer patient blindsided by swelling that now affects something as fundamental as swallowing, know that you're not alone navigating this complex and emotional journey. We strive to lift awareness, to lift care, and most importantly, to lift you as a patient by providing support and education that allow you to manage your chronic swelling on your terms and get back to living your best life.
These patient stories touch me greatly, and I will tell you that the story of the lower lymphedema patient is actually my mom. And the journey of my mom, similar to the journey of Sue and Sarah, started with a very familiar theme, and it was around navigating and navigating alone and not necessarily being able to find someone that could help. And so the stories of these individual patients and the journeys that they have been on is truly what inspired the video that you saw up front. I will tell you that initial video, when we were working through it, it was, it's a bit, it's not very happy. You're not seeing people dancing in the street. You're not seeing people, you saw my mom with her horse, this idea of people living their life. But the reality is that the voice of the patient needs to be better understood, and it needs to be shared. And so not only is the video that you saw up front something that we feel very serious about in terms of that it's a call to action, and lifting care everywhere is something that needs to be done, but these 3 patient stories also compel us on that way. And it's a little extra special for me knowing that one of them is my mom, and the fact that she was diagnosed by a CLT and got her on her journey, and she's in a much better place now. Let's go to the next slide, because what is also very interesting about this, not just the video that we put together up front, as well as the patient stories, but there's been actually a lot of research that has been done in this area to identify what is the current journey for patients. And over here, we're going to show a video clip in just a second, but this is Dr. Stanley Roxon. Dr. Roxon is one of the premier lymphedema specialists in the world, and he tells the story and has done this research that I think will speak to all of you, and hopefully you'll feel very heard. But this quote really gets to me, and I'm going to read it out loud because for me it's so compelling as to why we're here and the work that we're doing. This patient said, "My GP told me there was no such thing as lymphedema. It was all in my head. And while she was berating me about that, I got up and left." I know this is the story and the journey for many patients, and let's hear directly from Dr. Roxon that goes into even more detail about what this means from him as a clinician.
So let me start with a direct patient quote from a 59-year-old female. "My GP told me there was no such thing as lymphedema. It was all in my head. And while she was berating me about it, I got up and left." This really is the subtext of tonight's discussion and was the motivation to conduct the study. The issue is we need to understand what is happening to patients with lymphedema within our healthcare system. I've been working in the lymphatic disease arena for 30 or 35 years, and I've been quite convinced on a subjective case-by-case basis that these patients feel neglected, overlooked, dismissed, and that we really are not providing the resources for them that they feel that they deserve. But it's never, to my knowledge, been documented. So with a grant from the Centers for Disease Control, which allowed us to look at lymphedema as a chronic disease.
So not only is it taking just the voice of the voice of the patient and talking about it in the podiums and the forums that Dr. Roxon has available to him, but the research and the actual scientific work behind this is very clear. So Dr. Roxon and colleagues actually did a study, a global registry study of nearly 2,000 patients. It had 23 items and questions that were solicited to better understand the pathway for patients. And while there's a lot of data in the study also speaking to physicians' understanding of the disease and how they feel about the pathway and the care pathway that's available for treating patients, the data that I'm showing you here is very specific to the patient journey. And this is what patients said. 63.4% of them said that it was more than a year after their symptom onset that they actually were diagnosed. So the symptom onset and understanding that maybe it wasn't just feeling heavy in the legs, or maybe it's seasonal, or maybe it was something I ate, which we know a lot of patients start to go through when they're seeing swelling, but actually getting a diagnosis after symptoms are presenting was the dominant experience for patients. Again, 63.4% of them got that diagnosis after a year. 80% of patients had to see more than one physician to get a diagnosis, with 31% seeing more than 5. I will tell you the story of my mom. She saw over 5 vascular specialists and her GP for her symptoms and was finally diagnosed by a lymphatic therapist after more than 15 years. And so knowing that this happens to many patients, it also feels very unacceptable. 65.2% of the patients from this study waited more than a year after diagnosis to even receive treatment. So by the time you get to the actual diagnosis, after having seen multiple physicians, there's still a long wait to actually receiving therapy. That's for the non-cancer related patients. And you would think, well, maybe for the cancer related patients, it looks better. In some cases, it does. Versus the non-cancer. But once I share with you these data, I think you will agree that this is also unacceptable. During cancer treatment, 77% of cancer patients were never even questioned about lymphedema, and 89% of them were never tested for lymphedema. You saw the story of Sarah. 90% of patients with head and neck cancer are going to receive, unfortunately, lymphedema as a disease state secondary to their cancer. And yet many of these patients fall in this category of never being questioned and never being treated during their cancer treatment. After cancer treatment, about 58% of all patients with cancer are going to receive or going to experience symptoms within 12 months. Only 57% of them are going to still not even have been tested for lymphedema, and that 50% of them are going to be diagnosed by somebody other than the oncology team for this condition. So there's a lot of work that needs to be done to help support training and education and awareness so that whether the patient has cancer or non-cancer, that they can get quickly and get access to therapy as well as quick access to a diagnosis. The therapy options for patients with lymphedema, you're going to hear more about it from our esteemed panelists, but the proportion of patients that are actually referred on to lymphedema therapy are actually, again, very underwhelming. And this again comes from the study from Dr. Roxon. 22% of them self-referred are coming from cancer, 21% from non-cancer. Those are the ones that are self-referred. Those that are seeing a physician referred to therapy, you see slightly higher rates for cancer patients versus non-cancer. And then those that are not referred at all, you see a much higher prevalence of those that are in the non-cancer category that never even get referred onto a therapist.
Thank you for walking us through that important and impactful data, Sherry. I wanted to share another research article that shows that not only are there barriers to receiving a lymphedema diagnosis, like Sherry talked about, but there are also barriers to accessing care with a CLT once a patient is referred. This stat is always shocking to me, but according to Learn, there is only one CLT for every 1,000 diagnosed patients in the US. So a lot of patients face barriers such as CLT waitlists, rurality, insurance restrictions. Maybe the hospital system does not prioritize due to reimbursement, or patients have appointment fatigue. So all of these items can really prevent patients from even going to that first clinic and first visit with a CLT. So for you all on the call, if you are a patient and any of these factors are impacting you, know that Tactile is here to support you in bridging that gap. So next, I'd like to hand things over to our CLT, Alex Hill, and she is going to educate us on lower extremity lymphedema.
Hi, everyone. Thank you, Sherry and Caitlin, for getting us kicked off this evening on a really important topic, which is not only talking about lymphedema, but how do we manage it? What are the things to look out for? And so first we need to talk about what are some of the causes of lymphedema. So lymphedema is caused by disruption or damage to that lymphatic system. And there's a lot of different causes that you can see here on the screen. So the most common include vascular disease, including chronic venous insufficiency. So that's where those veins aren't quite working like they should. They're not closing off. And so that blood and that fluid can start to pool over time. Cancer, including the tumor itself, which can impact the lymphatic system, and cancer treatment like surgery and radiation can damage the lymphatic vessels, as well as primary lymphedema, which is due to genetic mutations, so that lymphatic system isn't quite working as optimally as it should because of genetic changes, and lipedema, which is a buildup of adipose or fat tissue in the arms, the legs, or the trunk, and that can also impact the lymphatic system as well. What's interesting, and you can see this statistic here at the bottom, is that 25% of those who have lymphedema have multiple causes that contribute to the lymphedema onset. So almost a quarter of people living with lymphedema, it's not because of one thing, it's often because of multiple things. And not just from the different conditions that I talked about initially, but also things like infection, obesity, trauma, that can include even a knee replacement surgery. I've worked with patients who've had lymphedema onset from that, immobility and other health concerns. So on the therapist side, as a lymphedema therapist, we want to make sure that we understand what caused it and also be able to explain that to you to have a better understanding. Next slide. So let's now take a quick look at the lymphatic system. If you're new to lymphedema and understanding the lymphatic system, think of the lymphatic system like a superhighway. So it's part of your immune system, and a healthy lymphatic system is going to help with maintaining fluid balance, help fight infections, and it removes waste from the body. On the picture here you see on the screen, that lymphatic system is all of the green, and you can see it everywhere from head to toe. And as Caitlin mentioned at the beginning with our introductions, myself and Margaret, we see people with lymphedema from head to toe and everywhere in between. So those lymphatic vessels are throughout the body. They act like blood vessels, but on these highways, instead of carrying the blood, they carry that lymphatic fluid. And so this highway system carries that lymphatic fluid filled with proteins, white blood cells, fats, and waste all throughout the body. And so when you think about those causes of lymphedema from the prior slide, you can see how a cancer diagnosis and treatment, trauma, and infections can lead to lymphedema really anywhere within the body. And so let's now take a look specifically at lower extremity lymphedema. Now, if lymphedema is not treated early and with appropriate interventions, it can progress. And we see here the different stages of lymphedema with an early lymphedema presentation on the far left with that stage 1 and a more advanced lymphedema on the right with that stage 4. With these stages, as they progress, there's certain signs and symptoms that are characteristic with each stage, and we're going to go through those next. But when you look at this first picture, that early lymphedema, one of the key characteristics is that lymphedema is reversible and it reduces with elevation. So if your legs are puffy or your ankles are puffy by the end of the day, and then you prop them up as you're watching your favorite TV show, or even you wake up the next morning and your legs and your ankles are a lot smaller, that would be considered reversible. If we look at those more advanced stages, then those are going to be not reversible, meaning it doesn't matter how much you elevate them, that swelling persists, and that's because of that fibrosis and some of that kind of cellular damage and changes that have occurred because of that lymphedema progression. Some of the other signs and symptoms to look out for, we'll look at on the next slide. And these include everything that you can see here. So there is, as I mentioned before, the swelling that will not reduce with elevation. Pitting edema. So if you press into the skin, you hold that for 30 to 60 seconds, you remove your finger and that indentation stays, that would be considered pitting edema. On that middle picture, that's something that the therapist would do to check. It's called the stemmer sign. If it's positive, meaning if I try to pinch the top of your skin between your first and second toe and I can't pick up that skin, that would be a positive sign and can indicate lymphedema. And then those last two pictures are different examples of skin changes that can occur as well. Skin changes are typically seen with the more advanced lymphedema. You see on that second to last picture what's called pod orange. So it's a fancy way of saying that the skin kind of looks like an orange peel. It looks very dimpled. And then that very last picture, we can see some squared off toes, maybe some skin changes there, and also at the top of the foot, what's called a buffalo hump. So a lot of swelling at the top of that foot. On the next slide, we'll also see some other signs and symptoms to look out for. So in particular, decreased range of motion. And if you look at this picture, this first one on the left, you see that lymphedema throughout the leg. And you can see how that swelling can impact multiple joints. So it can decrease the range of motion and mobility at the hip, at the knee, at the ankle, and even the toe joints as well. You can have heaviness, aching, and tightness in the legs and even into the lower abdominal area. And you can also have mobility and balance issues. Again, because of that swelling in the leg, that can impact how those joints move, how you're able to walk, and maybe needing to keep a little bit more balance because of those changes with that swelling. In that middle picture, you can see an example of a cellulitis infection. So that's a common skin infection that can recur or happen repeatedly with lymphedema if it's not managed well. And then on the very last picture, just another example of some skin changes, in particular that hyperpigmentation or darkening of the skin in those affected areas. Now, with all of these different signs and symptoms, it's important to keep track of them. So that's one of the primary things that I teach my patients is to understand what your signs and symptoms are to look out for and how to track them. So you see the QR code here on the screen. You can go ahead and scan that, and that's just going to take you to this symptom screener that is really helpful. This is from Tactile Medical, and it's a way for you to track your symptoms very easily. And if you are at risk for lymphedema and you start to see, okay, I'm starting to check a couple of these, make sure your medical provider knows immediately. You can bring this into them and show them what these symptoms are. I also find this helpful for my patients who maybe we're decreasing the frequency of our visits, we're going farther in between visits, or maybe we're discharging. And this is a really great way for them to track each month. Okay, am I having more symptoms than the last month? Maybe that's an indication that you need to get back in and start treatment. So, again, this is a really handy screener for lower extremity lymphedema, both for us as clinicians, but also for you if you're living with lymphedema as well. Now, we need to now talk about how it's managed, right? Caitlin and Sherry did a great job talking about the impact of lymphedema and some of the barriers, but what happens once you get into treatment? So, complete decongestive therapy, you can see that term at the top there. It's shorthand as CDT, but this is the gold standard for treating lymphedema regardless of where it's at in the body. With complete decongestive therapy, think of this as an umbrella term, and then everything else underneath it is encompassed. So, complete decongestive therapy includes manual lymphatic drainage. That's that first picture there, MLD. That's a hands-on technique that we utilize as certified lymphedema therapists to help with moving that fluid out of the affected area, getting it back into the system. That second picture there, compression. So we first need to reduce that swelling, reduce any fibrosis or hardening of the tissue, and we will utilize compression wrapping that you can see here to get that leg smaller. And then once you discharge or getting ready for discharge, then we would transition you to different types of compression garments, maybe compression stockings, compression pantyhose or shorts, and even nighttime garments that can help maintain that swelling. On the third picture, exercise. So the lymphatic system needs muscle movement. It needs pumping to help it get going. So if you're sitting down, if you want to join in, you need to get some lymphatic fluid pumping, go ahead and do some ankle pumps, do some ankle circles, go both directions, and really getting a lot of movement in those ankles is a really simple way just throughout the day to get some movement with your legs to help that lymphatic system stay healthy and supported. Skincare is going to be key. You saw that I mentioned infections several times. There can be skin changes. So with skincare, we want to make sure that it is staying moisturized and reduce the risk for infection. We also do a lot of education. So you should understand what your risk for lymphedema is, but also what are your treatment options? How do you best manage it? And answering all of your questions that you can have. And then finally, PCD, which you see here at the very bottom, pneumatic compression devices, these are commonly called pumps. And so on this next slide, we'll talk about really how can we integrate them in well within complete decongestive therapy. So again, that complete decongestive therapy encompassed everything we talked about on that last slide. And what we find is a really great approach is a hybrid approach. So by working together with lymphedema therapists, with that in-clinic manual lymphatic drainage, helping to move that fluid in conjunction with the at-home treatment, like using a pump, this can be a really great way to stay consistent with your care well after you're done in the clinic.
Thanks, Alex. And I love how you emphasized clinic visits are just one part of the patient's lymphatic care. And what you do at home is really what helps you stay on track as a patient. So I always heard CLTs talk about it as in clinic, and then your homework is at home and things that you have to do every day to get better. So if you are a patient on the webinar tonight, you may ask, what can I start doing today? How can I empower myself to maybe learn home exercises and management? So what we see here is our website, and we have videos and step-by-step guides on how to do manual lymphatic drainage. We also have links to exercises to help improve swelling and webinars and articles for you all to continue to learn about your lymphedema. We always say that knowledge is power, and we want you all to really be your own champion as you navigate this disease. So I'll pause for just a second. There is a QR code. We'll have that at the end. So if you do want to scan the QR code, just know that any of the guides, videos, or website, you can scan directly at the end of the webinar. So with that, Alex is going to continue, and she's going to kind of pivot to talking more about the breast cancer-related lymphedema occurrence and symptoms.
Great. Thanks, Caitlin. So if you remember from my first slide, there's a lot of different causes of lymphedema, but when we talk about breast cancer-related lymphedema, this is specific to breast cancer. So not only the tumor itself, but also the treatments that you can see here at the bottom. So in the very first picture, you see that there are lymph nodes and lymph vessels throughout the breast and into the armpit. Oftentimes, what the oncology team will do is sample some of those lymph nodes from the armpit to see if there's any cancer that has spread into those lymph nodes. What we know with these lymph node biopsies is that the more lymph nodes that are removed, that's going to increase the risk for developing lymphedema. So again, on the therapist side, I want to know what type of surgery you had, how many lymph nodes were removed. In that middle picture, radiation therapy, which is commonly used for breast cancer treatment, it works very, very well for killing those cancer tumor cells. However, it also is going to impact all of the surrounding tissues around that tumor site. And if you, again, remember that lymphatic highway, it's going to impact all of those lymphatic vessels in that area of that radiation field. And so you can think of a 10-lane highway going now to maybe 3 lanes because of that lymphatic damage from the radiation. And you can see how that fluid can start to get built up and start to develop into lymphedema. And then the last picture there is on chemotherapy. So there are some certain chemotherapies that can impact the lymphatic system and how it propels that lymphatic fluid. And then just like we have those different stages of lymphedema for the lower extremity, we also have those stages for the upper extremity or for the arms. We see some of those same characteristics. So with the early stage lymphedema, you're going to have it be reversible. So again, when you wake up in the morning, maybe your arm is a lot smaller. And then as that day progresses, that swelling gets worse. So it's reversible. But with those later stages, there can start to be difficulties with that arm volume reducing because that lymphatic fluid, those proteins, it starts to develop and it makes it harder for that lymphatic fluid to actually come back down. And although there's no cure for lymphedema, regardless of if it's in the leg or in the arm, there is effective treatment available. So we talked about that complete decongestive therapy. And when it's utilized, again, early and appropriately with a certified lymphedema therapist, your symptoms can be managed very well to help you live a better quality of life and to also continue living your joys. So before we get into the treatments for breast cancer-related lymphedema, let's take a look at some of those other signs and symptoms. So what things should you be looking out for? So you can have pain or tightness, especially if you've had radiation therapy or surgery. Changes in the surgical scars. So those scars, especially when they're swelling in that area, can get taut. They can become more painful. They can almost kind of get puckered in and pulled in because of that swelling or the fibrosis. So you might notice some scar changes. There can also be thickening of the skin. So it just feels thicker. It feels more dense. It's not as pliable and movable as it was. And you can also have discoloration. So you can see here on the third pictures a little bit of redness in the breast, but you could also have a darkening of that skin as well, especially for those with darker pigmented skin. You can have fullness or heaviness in the breast or in the arm. You can have limited range of motion, and that doesn't mean just in the shoulder. You can have decreased range of motion in your elbow, in your wrist, in your fingers. But what we also see in the clinic in the research is breast cancer related lymphedema can also impact how well you move your neck and also your spine as well. And then finally, in that last picture, if you have increased swelling, that can impact how your rings fit, your watches fit. Maybe you can't wear them because that swelling is so much and you're not able to get them on and off easily. And Tactile Medical does have a symptom screener for breast cancer related lymphedema as well. We do have that QR code there, so you can go ahead and scan that and get your free screener. And what I want to give you close attention to here is that this isn't just looking at the arm lymphedema. A lot of people associate breast cancer related lymphedema with just swelling in the arm, but you can also have swelling and lymphedema, as we saw in those pictures, in the breast and in the trunk and even in the upper back. Unfortunately, with breast lymphedema and trunk lymphedema, there's no gold standard for diagnosing it like your arms. It's easy to measure from side to side with your arms. It's much more difficult in the trunk. And so I do find that this trunk or this breast cancer lymphedema screening tool, in particular with the trunk symptoms, is very helpful for my patients, both between visits and if we've discharged, or even if they're just at risk for developing lymphedema, so that they can keep better track of it. So now let's get into some of the treatments. So as I mentioned before, that complete decongestive therapy is still the gold standard across lymphedema. The National Comprehensive Cancer Network, or NCCN, they have survivorship guidelines that they update, and their most recent update does recommend treating lymphedema early. That means those earlier stages, it's still reversible, within clinic therapy, and to consider those pneumatic compression devices or those pumps in conjunction with that lymphatic treatment in the clinic and continuing that at home. So you can see on the left that in-clinic treatment, again, education, lymphatic massage, exercises, so shoulder rolls, doing some spirit fingers, skin care, exercise. These are all things that we need to manage lymphedema optimally. And then when you transition to home, again, you're continuing to do all of this independently. And I tell all of my patients this, but consistency is key. Doing your lymphatic massage daily is going to be important, but that's where I find that the pumps come into play. And you can see that in that middle picture at the bottom, where instead of having to make sure that you're doing the lymphatic massage correctly every single time, every single day, with the pumps, you're just putting it on, turning it on, and then it's doing that lymphatic massage for you. So I do find that that's helpful for long-term management, because at the end of the day, we want to make sure that you have the tools that you need. We want to make sure that you have the right compression garment. So you can see that compression bra in that second picture there. Compression bra, compression vest, compression sleeve. We want to make sure that you have all the tools that you need at home. Next slide. And so again, we see that really for optimal management, it's not just in clinic, it's how do we also make sure that we optimize how you're managing it at home, including the use of these pumps that can really complement your care long term.
Thanks, Alex. So again, I heard about the importance of ongoing treatment at home for this patient population as well. So this slide has guides and videos for breast cancer patients on how to do manual lymphatic drainage at home. This will really give you the confidence you need as a patient to know that you're doing MLD correctly. Another thing I wanted to mention, just the videos here, these are done by Kelly Sturm, and she has additional videos on our website that clearly educate patients on the most common issues breast cancer patients face. So maybe you're wondering, what exercises or stretches should I be doing after surgery or after radiation? Or if you want guidance on axillary cording and relief, Just know that all of those are on our website as well as resources. So the final topic and patient type is going to be head and neck cancer and head and neck cancer related lymphedema. So I'd like to hand things off to Margaret, who's going to share more.
Thank you, Caitlin. And good evening to everyone who's joining us this evening. So in the head and neck region, the lymphatic system plays a particularly important role. Over 1/3 of the body's lymph nodes are located in the head and neck, and they form a dense, complex network that's responsible for fluid balance, immune function, and tissue health. And when cancer develops in this region, treatment often involves tumor removal, lymph node biopsy or dissection, and radiation therapy. And while these treatments are life-saving, they can also cause damage to the lymphatic nodes, vessels, and capillaries. When lymphatic transport is disrupted, fluid begins to accumulate in the tissue, and over time, this can lead to swelling, inflammation, and progressive fibrosis, both internally and externally. Next slide. So one of the reasons that this topic deserves our attention is the high prevalence of lymphedema in head and neck cancer survivors. Research suggests that up to 90% of patients experience some degree of lymphatic dysfunction following treatment. However, the presentation can vary widely, and many of the signs and symptoms are often subtle and easily attributed to other causes. As a result, the condition is often under-recognized. In the head and neck region, lymphatic impairment can affect both external tissues, such as the face and the neck, and internal structures involving breathing, swallowing, and speech. Patients may report dysphagia or difficulty swallowing, pain, tightness, discomfort in the neck and face, scarring or fibrosis that reduces tissue flexibility and movement, reduced range of motion in the neck and jaw, and difficulty speaking if swelling affects the airway structures. It's quite common to hear vocal changes and difficulty speaking. And because these symptoms affect such fundamental functions, early recognition of lymphatic dysfunction is essential in survivorship care. Next slide. So with head and neck cancer-related lymphedema, we can see the presentation in a variety of ways, often involving both structural changes and functional limitations. One of the most common signs is swelling, as you can see in some of these pictures, which may appear externally in the face or the jaw or the neck. However, swelling may also occur internally, affecting structures such as the tongue, the throat, and the airway. And because of the complexity of this region, even small changes in tissue volume can significantly impact function. In this slide, we can see that over time, scar tissue, radiation fibrosis, and chronic lymphostatic fibrosis can lead to further stiffening of tissues and can contribute to a decreased range of motion, both internally and externally. These changes can interfere, we'll stay on that slide. These changes can interfere with everyday activities such as turning the head, chewing, and maintaining a comfortable and upright posture. So in this slide, we'll see that not only does it affect the external components, but it can also affect essential functions such as swallowing and breathing. Patients may develop dysphagia, which can make eating and drinking difficult. Patients may experience airway discomfort and breathing challenges when swelling occurs internally, as you see here. And taken together, these symptoms illustrate that head and neck lymphedema is not only a cosmetic issue. It can significantly impact communication, nutrition, mobility, and overall quality of life. Next slide. So when patients begin to notice swelling, tightness, and functional changes, one of the first things they ask is, what can I do about this? And what we highly recommend is that patients report these symptoms to their healthcare providers. Tactile Medical offers a wonderful symptom screener. Feel free to take a picture of the QR code here. And this can be very useful when reporting symptoms to your healthcare providers. Next slide. Fortunately, we have a well-established treatment strategy set up for managing lymphedema. Early intervention can help reduce symptoms, improve function, and potentially prevent disease progression. Treatment typically involves two complementary components, as Alexandra mentioned, the in-clinic therapy and the ongoing home therapy. And together, these approaches create consistency of care and support long-term symptom control. The primary function of in-clinic therapy is to decongest the tissues and reduce lymphatic fluid volume. Patients often receive frequent treatments initially, depending on symptom severity, and a specialized lymphedema therapist may provide manual lymphatic drainage to gently stimulate the lymphatic flow, compression therapy, including compression garments and taping, targeted exercises that promote lymphatic circulation, skincare and scar management, and this is particularly important with our head and neck cancer patients. Many times we have to drain through the scar, so scar management becomes an important piece of our care. And of course, patient education, which is essential for long-term self-management. This initial stage helps reduce swelling and improve that tissue mobility. And once that has been accomplished, the focus shifts to maintaining those gains and preventing symptom progression. Patients typically continue care through daily self-management strategies such as self-manual lymphatic drainage techniques, the use of compression to support lymphatic flow, regular exercise and movement, and ongoing skincare and scar management. Periodic follow-up with lymphedema therapists is an important way to monitor changes and adjust treatment as needed. A certified lymphedema therapist can be helpful both before, during, and after treatment, providing education, risk reduction strategies, and long-term support. The key is recognizing lymphatic change early and connecting patients with the right resources and support. Next slide, please. So as Alexandra said, one of the most important principles in lymphedema management is consistency of care. Research and clinical experience show that patients achieve the best outcomes when professional therapy is combined with ongoing home treatment. Hands-on therapy provided by a trained lymphedema therapist plays a critical role in the early stages. However, lymphatic care cannot stop when clinic treatments end. Ultimately, when patients combine hands-on clinical treatment with structured daily home care, they're often able to better manage symptoms effectively and maintain a high quality of life. When we talk about lymphedema related to head and neck cancer, we are not just talking about swelling. We are talking about breathing comfortably, speaking clearly, eating with ease, and moving through daily life with confidence. With awareness, early intervention, and the right support, we can help patients regain comfort, function, and control. That is the goal of lymphedema care and the reason awareness matters.
Thank you so much, Margaret. And if you didn't catch it, I just wanted to give Margaret a little bit of a shout out. The head and neck cancer patient at the beginning of the webinar mentioned that her CLT completely changed her life, and that CLT was Margaret. So Margaret, thank you so much for all that you do for patients. So last bit of guides here. So you'll see the self manual lymphatic drainage guides and videos for head and neck cancer related lymphedema here. And Margaret shared on the prevalence, and really to just quote one of our KOLs, he says, if you have head and neck cancer and you've been through treatment, you almost certainly have head and neck cancer related lymphedema. So we do encourage you, if you're one of those patients tonight, to connect with Tactile and reach out and try a demo of our pneumatic compression pump. So if we can go into the next slide, I just wanted to spend the last 10 minutes or so going through key takeaways. Then we'll get to some frequently asked questions as well as the questions in the Q&A, and then we'll pull up the resources that we mentioned so you can scan the QR codes. So in summary, I learned a great deal from our panelists, some of the best in the industry, and just wanted to kind of walk through the main points. So first off, really many things can cause lymphedema, but symptoms are manageable with the right treatment, is what we learned. Also, after cancer treatment, it's common to develop lymphedema, and many people learn to manage lymphedema successfully, and they continue living full, active lives. We learned that lymphedema is not curable, but it is very manageable with the right care of plan, and that is, working with the CLT and bridging the gap at home. Next is to pay attention to changes as soon as you can. Use those symptom screeners we discussed tonight and keep up with the regular check-ins. It's never too early or too late to take care of yourself. We've had patients that are 30 years out of cancer treatment and see a difference after seeing a CLT and working with Tactile. The next one is that clinic visits are just one part of your lymphatic care. I think that was a main point emphasized several times tonight. And what you do at home helps you to really stay on track. Provider education on lymphedema has room to improve, and Tactile Medical is committed to lifting care with those providers. And lastly, access to care is growing for CLTs, but there's still plenty of opportunity to expand availability in most states. So now let's move on to frequently asked questions, and I'll go to the Q&A as well. So this first question is for Alex. If I'm a patient on the webinar tonight, where do I go to find compression options?
So first, finding those different types of lymphedema compression options, including garments, supplies, should really start with first consulting with your certified lymphedema therapist for a personalized prescription, because there are so many different types that are available. You can get custom, you can get off the shelf, which just means that it would be like a small, medium, large. There's Velcro garments, there's nighttime garments. There's a lot of different types that you can get. And so first starting with your lymphedema therapist, but then many medical supply stores do also carry compression garments and different options. So reaching out to any that are local to you. But what's really nice now is the digital age, right? So there's a lot of different websites that people can get compression garments on, including Compression Guru, lymphedemaproducts.com. And one thing that I did want to note also is that if you're not familiar with the Lymphedema Treatment Act, this was a monumental law that went into effect in 2024, where essentially Medicare is now covering prescribed compression garments and supplies to treat lymphedema. So if you're over 65, if you have Medicare, Medicare does cover not just the compression garments, but also the supplies needed to do the compression wrapping, which is really helpful.
Awesome. Do you mind taking this next question as well, Alex, of how do I find a CLT near me?
So there's a couple different places that I recommend and I've used if somebody reaches out to try to find someone near them. So the Lymphology Association of North America, or LANA, has a certified lymphedema therapist directory. The National Lymphedema Network, or NLN, has one, and then CLOSE, that's KLOSE. Close Training also has a directory as well. But between those three, you're sure to find somebody who is close to you, or that can help direct you to somebody that's even closer to you to get the care that you need.
Awesome. Thank you. Margaret, if you could take this third question. So if I do self-MLD regularly, would there still be a need for me to get a pneumatic compression device, which is a pump? And if so, why?
Thank you, Caitlin. And I'll start that off just by saying that every person is different and every recovery is unique. But anyone who is at risk for developing lymphedema or with lymphedema should know how to complete effective self-manual lymphatic drainage. And your hands go with you wherever you go. So that is a great tool to have. However, there's some qualities about the FlexiTouch pump, some unique qualities that I find quite valuable. The first one is that the pump covers 360 degrees of the body. So while our hands can reach comfortably the front of the body and maybe the sides, we can effectively reach the back. And the pump will be able to do that. So it's a very, very thorough and complete drainage device. Second is that once we start treating lymphedema at home, we often have to build routines. And I feel like it's a little harder to build a routine with our hands versus a pump. One of the things that I've heard from my patients is that they'll combine an evening television show that they watch with the pump, or they'll listen to an audiobook, or they'll do their meditation. All of this helps with the consistent care that we've driven home. And Caitlin, if you'll give me a moment, I would like to just mention one last thing. I had a patient who expressed something years ago to me who this really made a lasting impression. She was being discharged from therapy and she was going home with a pump. And she assured me that while in the pump, she was going to learn a second language. And when I saw her 6 months later at her wellness visit, I asked her how she was doing with her second language. And she told me that for the first time, being in the pump had allowed her to relax. And that for the first time since treatment, she'd been able to begin to process not only her diagnosis, but her treatment, and to reflect on some of those constructive changes that she wanted to make moving forward. And I remember specifically, she said that the quiet time in that pump played an important role in her recovery. And I find that really interesting, and I've thought and used that many times. So yes.
I love that. Yeah, that's what we're all about and why we do what we do. So thank you, Margaret. These last two questions I do feel were addressed throughout the webinar, so I am going to go to the Q&A. One of the questions is, can these slides be available? Yes, we can send the PDF of the slides to all of the participants tonight. This next one, Alex or Margaret, if you feel comfortable answering, are there any surgeries that you can get that help with lymphedema? I know that there are surgeries available, and Tactile could help maybe point you in the right direction in terms of a surgeon in your area. But Alex and Margaret, anything to add on that question?
I will add there are some surgeries, and they've been on a little bit of a bumpy road. I think we are in the process of progressing both in nanotechnology as well as the skill set of our surgeons, but they are doing lymph node transplants and lymphovenous bypass surgeries. I can't speak to a clarity in the recovery from that, and I think it depends on the surgeon, but if you're interested, explore those and go into it with an open mind, and I think with the guidance of a therapist as well. Just because you have the surgeries doesn't mean that you don't have to complete decongestive therapy. It's all important nonetheless.
Yep, absolutely. This next question, I've seen a few about head and neck lymphedema. So do you have pumps for head and neck lymphedema patients that have a trach? Yes, we do. We can accommodate those patients. So if you want to reach out to your local representative, they'd be happy to show that and kind of work through a demo with you. Let's see, let's do maybe one or two more questions, and then I want to make sure I leave time for the links at the end. Let's see. So how can I get help using your pneumatic pumps? That will be on the next slide. So Maria, would you mind pulling up kind of the last slide here, just so that they can start to scan it? Because most of the questions in the chat are about this. So all of the educational resources that were discussed tonight, if you guys want to pull out your phone, open the camera, and you'll scan that first QR code. This talks about the self-MLD guides. It talks about additional videos. And this is broken down into lower extremity patients, breast cancer patients, and then head and neck patients. The teal box here is for you to scan a QR code for Kylie. And Kylie is a easy to use free mobile app that really helps you to manage your lymphedema symptoms. Think of it as kind of your lymphedema diary. And we've had patients share that not only is a cancer or a lymphedema diagnosis overwhelming, but as you're trying to navigate and learn about lymphedema, it's difficult, and they just want one source of truth that their therapist has seen and is researched. So Kylie has such great videos, has such great articles for you to really take, control of your journey. So that would be a great thing, again, if you want to scan the QR code in the teal box there. And then last but not least, I did see a couple of product questions. So over on the right here, if you'd like to find out more about our products, if maybe you want to talk to our clinical team, you can contact us at solutions@tactilemedical.com, and we would be happy to assist you or at least point you in the direction of somebody who either treats lymphedema or a CLT in your area. So with that, I just want to thank our panelists again, just such a wealth of knowledge. Thank you to Sherry Dodd, our CEO at Tactile Medical, for joining us. And just to all of you, for patients, for taking control, for wanting to learn this education and want to better yourselves through your journey. So with that, we'll go ahead and log off, and thank you all so much for joining us, and we hope you have a great evening.